Hey Tam, how's your day going? Oh, it's going good. What about yours? Good! Did you hear about the new Hyundai in town? Oh my god!
Oh no, somebody get an ambulance!
Oh my god.
I think she got hurt.
Let's go.
Call 911. Hello, yeah, we have an emergency at John Marshall High School.
Let's go.
We need to Welcome to Dr. Mills' clinic.
Oh, thank you.
Hello, my name is Allison. I'm your nurse.
Hi, nice to meet you. My name is Dr. Mills.
Hi, Dr. Mills. I'm Tam.
What seems to be the problem today?
I saw my crush and I just fell.
You saw your crush and
Yeah.
made you fall.
Yeah.
Where is your pain, Miss Tam?
Right here.
Let me take a look at that.
Okay.
Oh no, that looks pretty awful.
Yeah.
It looks like you could have some tissue damage on that.
What type of tissue?
Well, let's investigate this together. Let's dig deeper into the different kind of tissues to see which tissue might be affected in your scenario.
Thank you.
According to my research, epithelial tissue lines the surface of body cavities. And within epithelial tissue, there is 3 different shapes. We have columnar, cuboidal, and squamous. Columnar is long shape. Picture a column. Cuboidal is square and rounded, and squamous is flattened out. There are 3 arrangements that you can have of each of these shapes. You can have simple, which is a single layer. You can have stratified, which is multiple layers. You can also have pseudostratified, which pseudo mean fake, so this would be fake layering. Within the epithelial tissue, you have different locations of each individual classification. For example, simple squamous epithelium is found in the air sacs of the lungs, the lining of the heart, the blood vessels, and the lymphatic vessels. Simple cuboidal is in the ducts of the secretory portions of small glands in the kidney. One more example I will give you is that stratified cuboidal is in the sweat glands, salivatory glands, and the mammary glands.
Go.
Though I don't think that your scrape has epithelial tissue damage, let's look at another kind of tissue, muscle tissue. Muscle tissue has the ability to relax and contrast and so bring about movement and mechanical work in various parts of the body. There are 3 types of muscular tissue. There's smooth and muscle tissue. This is involuntary, so it automatically works for you. It is innervated, which means it is wired. It is found in organs and is mononucleated. The second type of muscular tissue is a skeletal muscular tissue. This is innervated as well, so it is wired. It is voluntary, so you choose to make these movements. It is multinucleated and is located pretty much anywhere in the body. The third type is a cardiac muscular tissue. It is found in the heart only. It is innervated again, so it is wired. It is mononucleated, and it is involuntary, so you don't choose to make these muscles work. Let's focus on the different types of connective tissues. It says here that one type is loose connective tissue. It is located beneath the epithelium between the spaces and the muscles, and it is a network of collagen, elastic tissue, and reticular fibers. Another type is adipose tissues. This cushions, insulates, and stores fat. It is found beneath the skin and between muscles, around kidneys, behind the eyeballs, around certain joints. I do not think your adipose tissue is affected.
Okay, that's a good thing to hear.
Another type is a reticular connective tissue. It supports. It is in between your liver, your spleen, lymphatic organs, and it is made of collagen. Your elastic tissue is abundant in elastic fibers. It allows recoils of tissue following stretching, is attached between vertebrae, ligaments, and within the walls of hollow internal organs. Let's see. Your bone tissue is hard calcified matrix without many collagen fibers. It is found in your skeletal system. And also, your fibrocartilage maintains shape with flexibility and is found in intervertebral discs, knees, and pelvic girdle. Hey, I think your fibrocartilage tissue could be something that we should focus on.
Oh, yay! We found something!
Even though I don't believe the nervous tissue is something we should focus on, let's just go over it for fun. Should we do that?
Yes, please.
The nervous tissue has two parts of the nervous system, the brain and the spinal cord of the central nervous system, and the branching peripheral nerves of the peripheral nervous system, which regulates and controls bodily function and activity. There are two types of cells in the nervous tissue. It is a neuron, which function is to direct, guide, and nerve impulse, and also we have the neuroglial cells, which support neurons.
I don't quite understand. Could you explain it a little more for me?
Yes, of course. Let's look at the structure of the nervous tissue, the neuron. So here we have the dendrites, and this is the nucleus. Here we have the cell body, the myelin sheath, the axon, the node of Reinbeer. Inside of these, which you can't see, are the Schwann cells, and then out here are the axon terminals. Does that make it more clear?
Thank you so much, Dr. Mills.
You're welcome. Well, it doesn't look too bad now, but if we look at scarring, there are two scars that could occur. One scar is epithelial tissue scar, and that is what lines your organs, so that would not be an issue. The other one would be connective tissue scar. Let's take a closer look at the scarring. Scars do not contain sweat glands, hair follicles, or skin protecting sebaceous glands. Because of this, the texture is usually smoother and it can become very itchy after it scars. The most common type of scar is a hypertrophic and has a raised appearance that extends over a formerly injured area. So in this instance, that is what could happen. So for now, I think let's just give it a little time to heal, and I'm going to have you come back in a few weeks and we'll discuss your scar and we'll see how you feel about that at that time, okay?
Okay, thank you so much, Dr. Mills.
Yes, you're welcome. Nice meeting you.
Nice to meet you too.
Welcome to Dr. Mills' clinic.
So Tam, how is your knee looking?
Well, doctor, I have an ugly scar.
Oh, don't worry, Tam. We have many medications to cure that. You can use Mederma, a topical product used to improve scar appearance.
Oh, please tell me more about Mederma.
Well, Mederma is a gel-based onion extract and is produced by Merz Pharmaceuticals of Frankfurt, Germany. It claims it can make scars softer, smoother, and less noticeable. The active content in here is allium cepa. To apply, you can put it on twice a day to reduce your scar as soon as the injury begins to heal. After 8 weeks, your scar should be less visible, and the skin on your knee will be much smoother. The only side effects that you could encounter is if you have allergic reaction, and you could encounter a rash, hives, or itching. But you should be okay.
Thank you, Dr. Mills.
Would you like a prescription of Mederma?
How much is it?
It is about $25 per application.
Okay, I guess.
All right, I'll write that up for you.
Thank you so much, Dr. Mills.